We're tracking the coronavirus cases across Davidson County. Just in the past 24 hours, there have been 478 new infections. More than 5,500 cases are active across the county right now. And when it comes to hospitalizations, 6% of beds are available across Middle Tennessee.
A new strain of the coronavirus hits Tennessee. Our state's Department of Health says we're seeing 2 cases of the UK variant strain of the virus here. Tennessee is among more than 20 states reporting new cases with this virus strain. The UK strain is considered more contagious. There is no evidence, though, that it's deadlier or causes more severe symptoms.
Right now, the biggest hurdle for vaccination in Tennessee is supply. Today, I sat down with the state's Commissioner on Health for an exclusive one-on-one interview about vaccination efforts in our state. From a conference room in the State Department of Health, Dr. Lisa Piercey lamented what she calls the #1 problem in Tennessee's vaccination efforts.
We're not having trouble getting it out. We're just having trouble getting the vaccine in. And some health departments are getting very limited quantities, 100 or 200 doses per week. They can go through that in a day.
Tennessee receives an average of 80,000 doses a week for a total of about 700,000 so far. Only 400,000 shots have been given out. The others are being held back for second doses. Right now, the focus is still on people 75 and up.
We have about 450,000 Tennesseans that are 75 plus. At the current rate, to get through 75-year-olds and up, we currently have a waiting list of about 100,000 folks.
Based on the state's plan, teachers are next. And today, we learned for the first time when teaching staff can expect their vaccines.
I'm hopeful that we can have all of our schools vaccinated maybe in the next 30 or 45 days.
Piercey says some districts have already begun. But for the general population, the question remains, when and where can I get vaccinated?
Pharmacies, doctors' offices. I think we've had over 1,800 providers say, yes, we want to be a vaccinating site.
How many of those sites have you been able to give vaccines to at this point?
0. Because we just don't have the supply right now.
That could change very soon when her federal contacts tell her there will be enough vaccines to be given out to retail pharmacies. The state will likely partner with Walmart.
I think in the next 2 or 3 weeks, you will start to see a very few number of Walmarts get some of their first doses. It won't be a lot because I don't have a lot right now, but in order to get to the most vulnerable and to remove barriers to vaccination, we too are going to be pursuing retail pharmacies probably in the next couple of weeks.
Dr. Piercey also told me there's a federal retail pharmacy partnership, and it could go live as early as April. It has about 18 big chains as partners. So we're talking about Kroger, Walgreens, for example. Once the supply chain opens up, the federal government will send vaccines straight to those retail pharmacies and cut the state out of that portion of administration, trying to make it simpler.